Hello, I'm Dr. Scott Trenhaile. I'd like to take a few moments to introduce you to some of the members of my team to discuss the important aspects about your upcoming surgery. Please feel free to stop the video and take notes so that you can address your concerns prior to your procedure. Thank you for your attention.
Hello, my name is Alyssa and I'm part of Dr. Trenhaile's nursing team. Prior to surgery, you may be asked to obtain lab work, a history and physical from your primary care physician, and/or clearance from other medical specialists that you are under the care of. Directions for all blood thinners should be coming from their offices. You may also be asked to obtain and use a preoperative skin prep solution prior to your procedure. If you have any questions or concerns, feel free to contact the office.
Preoperatively, you will have a visit scheduled back in the office prior to your procedure. At this visit, you will watch a preoperative teaching video and all your questions will be answered. Prior to surgery, you may be asked to obtain lab work, a history and physical from your primary care physician, and/or clearance from other medical specialists that you are under the care of. Directions for all blood thinners should be coming from their offices. You may also be asked to obtain and use a preoperative skin prep solution prior to your procedure. While each circumstance is unique, patients are typically prescribed postoperative pain medication and non-steroidal anti-inflammatory medications. We will provide you the prescription of your pain medication prior to your surgery to assure timely filling of the medication prior to your surgery. We ask that you please do not take the pain medication until after the completion of your surgery. These medications are for home use only and will not need to be brought with you the day of your surgery. The medications are chosen so that they may be taken together safely as long as you follow the directions on the pill bottles from the pharmacy. It is important that you inform our healthcare team of all medications that you take on a regular basis, including supplements and over-the-counter medications. You may be asked to stop some of these medications prior to your surgery. The day of your surgery, please come to the procedure with a driver that can stay throughout the entirety of your case, as this is an outpatient procedure and you will be going home the same day. Please make sure to wear loose-fitting clothing that was easy to put on after your procedure. If a shoulder procedure is being performed, an oversized button-down shirt is best the day of your surgery, as it will comfortably fit over you and your pillow sling. Surgical patients typically receive general anesthesia in which you will be completely asleep. In addition, it is usually recommended that a regional nerve block also be given in combination to the general anesthetic. During the block, you will be able to breathe on your own, but will be unaware of the block procedure taking place. Generally, I recommend the nerve block as it should provide numbness that typically lasts 12 to 24 hours in duration. This will allow you to start your oral pain medication at home as directed while the block wears off. Starting the oral pain medication as the feeling begins to return allows for a smooth transition between the regional block and the oral medication. Side effects of the block also include the inability to move your extremity to include fingers and toes depending on an upper versus lower extremity block. The inability to move your extremity typically resolves when the feeling returns or possibly sooner. It is very common for patients undergoing upper extremity blocks to experience some pain in the armpit region after surgery, as the nerve block does not provide relief of pain in this area. Basic risks associated with the surgery include, but are not limited to, things like blood clots, infections, hematoma, failure of the procedure and/or implants, including loosening of the implants and dislocation, nerve damage and fractures, and need to repeat surgery. These risks are low, but are known risks to the procedure. As we get closer to your surgical date, your time for surgery will be released. If your surgery is on a Monday, you will receive a call from our office prior to 3 p.m. on the Friday preceding. For all other surgery dates, you will be notified by 3 p.m. the day before the surgery. Remember, nothing to eat or drink after midnight the night before your surgery. After anterior cruciate ligament reconstruction surgery, you will be placed into a knee immobilizer. Your brace should be worn fully extended or straight at all times, day and night, except for times that you are exercising or showering, until otherwise instructed after your first postoperative visit. Plan on wearing the brace for approximately 6 weeks after surgery if any type of meniscal repair was performed. Crutches are usually recommended to assist with walking. You are allowed to bear as much weight as tolerated on the operative leg unless otherwise instructed, with the brace on and locked in a full extension. So please do not walk without the brace on. You will be given written instructions before leaving the facility on the day of the surgery detailing the limitations that are specific to your procedure. A white absorbent dressing will be placed over your knee. This dressing is applied to keep the portals clean during the healing process. Immediately after surgery, the fluid used to distend the knee will leak from the portals and is then absorbed into the bandage. Occasionally, the fluid that comes out of the knee is blood tinge in color. Don't be alarmed, as this is fairly common. If you have any questions or concerns about the amount of drainage that is occurring, please call the number provided to you. The absorbed bandage may be completely removed 5 days after surgery, and then you may take a brief shower. Swelling is very common at this time. The knee immobilizer is removed and touch-toe weight bearing on the operative leg is allowed for balance. You will likely require assistance getting in and out of the shower the first couple times. At this point in your recovery, I do not recommend any prolonged exposure to water, including bathtubs, swimming pools, or hot tubs. After the shower, you may towel dry the surgical site and apply Band-Aids to all surgical sites. Do not try to clean the operative soap from your knee, as it has to exfoliate or wear off with time. Early exercises are allowed to begin the rehabilitative process. It is not uncommon to have your first physical therapy appointment prior to seeing our team for your first post-op visit. You may begin exercises at home 24 hours after surgery to include quad sets, heel slides, ankle pumps, unless otherwise instructed. Performing ankle pumps continuously throughout the day will help to reduce the risk of developing a blood clot in your calf. It is safe to bend your knee in a non-weight bearing position while performing exercises unless otherwise instructed. Elevation of the leg above the chest will aid in the reduction of swelling and help to reduce pain in the knee. Avoid driving until you are seen back in the office 7 to 10 days after surgery. Further recommendations may be given on your first postoperative appointment. During this visit, we will remove sutures if present, discuss with you arthroscopic photos that were taken at the time of surgery, and also discuss next steps of your rehabilitation process, including physical therapy and brace timeframes. Therapy may begin as early as 7 to 10 days postoperatively, depending on what was found at the time of your surgery. A typical rehabilitation course runs approximately 3 to 4 months, with a return to sport at 6 to 9 months. At the conclusion of this, it is important to note that knee remodeling continues over the course of 1 year after surgery, and it may take a full year to achieve maximal use.